Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about what to expect from orthognathic or jaw surgery. And a lot of times I work with doctors and we talk about, the options. Anytime you're doing any type of orthodontic case, be it Invisalign, ClearCorrect, SureSmile, I don't care what it is, Candid Pro, any type of orthodontics that you are responsible for, you are also responsible to explain the risks, the benefits, and the alternatives on every single case. And I always say, if you do not understand the alternatives, you have no business selling this case. You need to make sure the patient understands the alternatives. If you can't give that case presentation, you need to refer this patient to ortho. They can go get the alternatives and all the options explained by the orthodontist. Who knows? They might decide to stay with that orthodontist. Maybe they won't. Maybe they decide to go back to you to do the more limited case. But at least they've had their alternatives explained. If you fail to do that, you are breaking standard of care, and it can potentially come back to bite you later. How and why? Well, if the patient never had that explained to them, and you'd have to document in writing that it was explained. You can't go back and add it later, then you didn't explain the alternatives, then that's a risk for you from a dental board or insurance company. And I'm not going to get into that, but I've been on the flip side with the expert witness situation where doctors hadn't done that. And I'm pretty sure you're given a refund and quite a lot more. So keep that in mind. It makes me a little frustrated when I see all these different types of aligner classes that are out there, and I'm not going to name who they are, that are social 6 treatment, anterior only treatment. And they don't really explain. They explain that this is short-term ortho and that it's an option. But unless you're also explaining the comprehensive option, that's your job as the doctor to do. You can't just think they're going to sign a form. So that's why I want to talk a little bit about jaw surgery, because a lot of times these cases are orthognathic cases and we're just straightening front teeth and leaving the bite funky, okay? So you have to know how to explain the jaw surgery. So let's talk about it. Now, first of all, lots of different types of jaw surgery. And guess what? Me as the orthodontist, I don't decide which jaws are getting moved. I decide that I think the patient needs jaw surgery, and then I'll be glad to provide the orthodontics that will help guide the jaw surgery. And then I go find my friendly oral surgeon who does a lot of jaw surgeries. Patient goes in, gets worked up, has a series of x-rays. Of course, one of them is a Ceph, which is what I take anyways, but other x-rays. And the oral surgeon will decide, hey, yeah, this is going to be a 2-jaw surgery, or this is going to be a 1-jaw surgery, or this is going to be a 2-piece maxillary surgery. So what are our options? We can take the lower jaw, we can do a sagittal split, we can move in a class 2 case, we can move the lower jaw forward, okay? Sometimes they will take the lower jaw and move back, but it's very rare, take out a section. I don't know if I've seen that before. More likely than not, they're gonna take the maxilla, they're gonna break it and either impact it and change the position of it, like a posterior impaction, or they're gonna break it in 2 pieces. They're going to take it away from the maxilla, from the cranial base itself, and move it forward, or tip the angulation of it, which will change the position of the mandible, especially in a long face. Or they might split it in 2 pieces, and now you have multiple pieces, to make it also wider. So there's a lot of different options, and this photo represents the sagittal. So in this case, they took a piece out of the mandible and set it back. I don't normally see that happen. I usually see the maxilla moving forward because that helps the airway, but this is just a stock image, so that's how she was fixed. But ultimately it comes down to the measurements and what the oral surgeon finds, and of course they communicate with the orthodontist. And then our job as the orthodontist is to straighten the teeth and remove the decompensations. To decompensate the teeth, remove the compensation so that the teeth are the way they are. So for example, let's say here, this patient is class 3, the incisors have tipped crazy forward. I can tell they're super flared. We looked at the Ceph numbers, we noticed that because they're just trying to be kind of normal. But if I put the incisors back where they were supposed to go and uprighted them, she'd have a much worse class 3 bite. Sometimes in these cases, the lower incisors are actually upright, and this one's kind of are. So we might straighten them and put the lower incisors exactly where they're supposed to go. So we're essentially making the class 3 bite look worse, removing all the compensations, so that when they take this jaw, cut it, and move it forward to help harmonize the profile. And you can tell the profile's out because if we drew the E line goes from the tip of the nose to the tip of the chin, lower lip is supposed to be behind the E-line by a millimeter or two. Upper lip is supposed to be close to the E-line but not at it. So our upper lip is behind and our lower lip is ahead. So that's the whole point, is to give the patient a nice E-line profile. So that's why they would do what they do. So my guess is that they probably wouldn't mess with the lower jaw here. They'd probably only mess with the upper jaw here to try to give the patient a more harmonious profile. So anyways, that is jaw surgery in a nutshell and how it would work. And I also like to always say, really look at your patients, because sometimes, I mean, jaw surgery, the whole jaw surgery orthodontist modality, first of all, not all orthodontists take jaw surgery cases. And to be honest, I stopped taking them after residency, partially because the offices that I worked with were group dental offices, highly GP and pedo focused, and they just didn't have the support staff, and we were not open every day for ortho, and it just didn't work. You know, like whenever you take orthognathic surgery cases, you got to be there, because real emergencies happen. And when the oral surgeon says, we're going in for surgery tomorrow, I need to go put my surgical hooks on. I need to be there. If it can't be a satellite offices, and all mine were satellite offices. So it just didn't work. Nor was my staff trained, and my front desk was not trained to handle it. So it's, you know, it's your choice to take that kind of surgeries or not. There's always people that will take them. Universities always take them. Also, the other issue is we were a highly, almost all HMO, DSO, not so great insurance kind of practices. So reimbursement is super low, and we never got reimbursed more for oral surgery cases, than we would for a regular just class 1 case. And surgery cases take 3, 4, 5 years. I mean, they are 10 times the work of a regular ortho case. So, you know, in the real world, it's tricky, because if you take surgery cases and their insurance, you're basically losing a ton of money on it. So I hate to say it, but that's just how it is. So would I take it as an insurance case? No. And my cash price would probably be $15,000 to $20,000. It'd be a heck of a lot, you know? So always better, I think, if you have an orthognathic case, and if you don't have a ton of money, to go to a orthodontic program at a university, because they're going to be reasonable. The students have to have that kind of case in order to graduate, and the work is going to be really, really good, because they're super supervised by all kinds of professors, you know, and they're writing papers on it and all that. So that is always my suggestion. You're just going to get good work, and it's going to be affordable. I mean, it may not be the most efficient work, but it's going to be done right. So yeah, that's my recommendation. Yes, I've done several jaw surgery cases, you know, but not really a huge fan of it, but it's life-changing. And the other thing I just mostly want to say is that keep in mind, at least in the US, there's quite a few medical insurance companies that will fully approve the surgery if it's proven that the patient has a compromised life not having it medically, whether they're having difficulty eating because of that anterior open bite, or have severe sleep apnea because of that small lower jaw, you know, or difficulty eating because of that huge lower jaw. You know, they can't bite into a sandwich, they can't chew properly, they're having severe pain in the jaw joints, all these things I can mention, that if you do have a huge discrepancy, you're gonna have things that are not normal in your life, you know, and it will lower your life expectancy, it will. So you'd be surprised if you have a really good oral surgeon, they can spin it, and they can definitely they know how to medical bill. And there's a very good chance that you can have your surgery completely covered, you know, or as much as your medical insurance will cover things. You may have a very little to no copay. So, you know, keep that in line. Your ortho still might have to be covered. But again, if money is an issue, always go to the university, because they are brilliant at getting things covered. I mean, because they're a university, it's a teaching institution. So you're always going to pay less, if possibly not at all, you know, if they're able to get coverage from the medical insurance. So check that out. And I really, really always press my doctors to make sure the patients understand that, because again, where you can get yourself in trouble is if you go and you start messing with some of the teeth, they may be excluded from ever being able to get this surgery again, because they already got their orthodontics, even if it wasn't done right, or it was half-assed or whatever, and it wasn't done to fix the real problem. So if you do not explain the risk, benefits, and alternatives, and do not explain this to your patient, that by doing this now, this social 6 treatment, or this just improvement or compromise treatment, it may exclude them later from being able to get the surgery if and when they need it for health reasons. If you don't explain that in writing, you could get yourself in big trouble. So, and the patient would have, you know, a reason to come after you. So listen, I'm not trying to fuel the fire, but I want to make sure you guys aren't being lazy and taking cases that really should be treated by an orthodontist and an oral surgeon, you know, or at least let the patient make that decision and be fully informed. All right, thanks so much.